do you fix a hypermobile hip is the question. And that's kind of like someone asking a surgeon, how do you do such and such surgery, and do so on a YouTube video within certain number of minutes. So I'll do my very best and bring the big pictures in your head. So if this is your hip, your pelvis, and this is your hip joint, that's a ball and socket joint. So the hip joint is part lower extremity and part pelvis. So you cannot, and in the world of clinical rehab, we should never only address the lower extremity, expect to see result here, because what we fail to do is look at the stability and the integrity of the socket portion, which is provided by the hip, by the pelvis. The pelvis itself is controlled and influenced by the structures above and the lower extremities, as well as the different pieces that make up the pelvis. So when it comes to hip issues, what I do with the patient, number one, is biological breathing. We'll make sure that we put that at the end of this video. I have done videos on why that's important. And in this case, it allows you, your breathing apparatus allows you having a better batting average in stabilizing the structures above and the pelvis itself. So once I have that, then I would 100% work on stabilizing the trunk. We did a video on what I would do if I had pelvic floor dysfunction on a different channel I have. I'm going to ask my technical support to see if we can have that video put here. If not, we're going to give you a link to that in the description box, so that becomes an option for you to look at. All of those exercises are what I would do in an attempt to stabilize the trunk, which means stabilizing the socket portion of this hip joint. Once I have done the stability of the trunk and my trunk can do its job while my lower extremities can do their job, and when I can stabilize the lower extremities and move the trunk around, those are all exercises that the link that I told you about, some of them are provided. That's when I would address the hip joint. So if you're looking for one or two exercises, it's not gonna work. When it comes to joint hypermobility, one of the things that is 100% from my experience I see in every single patient is pelvic floor dysfunction. I did not say incontinence, not necessarily, but pelvic floor dysfunction means instability of the pelvis. So when that happens, then your lower extremities, your adductors and your gluteus medius do not do a good job balancing your lower extremity. In the link I told you about, I showed you a squatting exercise, which is my go-to exercise to practice the connection between the two. So I didn't give you one or two questions. I just let you know that this question is too broad of a question to do a YouTube video on. This could be multiple videos by themselves. And so if you have this issue, please contact me. I'll be more than happy to schedule a time we can discuss this more if you are within the reach to our office. If not, there is a telehealth coaching that's available. All of this information is in the description box, and if you can access it and you have any questions, like I said, just contact me. Thank you so much for subscribing and following us.